So, trauma also generally is used to talk about traumatic events. We say so and so has had trauma, meaning that that person has suffered one or more traumatic events. But in truth, what our patients bring to us is not their events. They bring a living legacy of symptoms. Symptoms of major depression, symptoms that we connect to PTSD, symptoms of all of the anxiety disorders, chronic pain disorders, addictions and eating disorders, suicidality and self-harm, and a diagnosis of borderline personality disorder. All of these symptoms have been associated with a history of trauma. Now, why do I call it a living legacy? Because as the brain scan research shows, under conditions of extreme stress, there is a failure of memory processing, which results in an inability to integrate incoming input into a narrative, leaving the sensory elements of the experience unintegrated and unattached. It was a finding that I think surprised even Bessel van der Kolk. Right? Because if we have a narrative that has a beginning and a middle and an end, we can say this terrible thing happened and then it was over. That's not the experience that our patients have. They don't have the experience of thank God it's over. And the reason they don't is of this living legacy of sensory elements.